Here part 2 of MCQs on digoxin with answers and detailed explanations. 1. What is the half-life of digoxin in a patient with normal renal function? A 6 to 12 hours, B 24 to 36 hours, C 36 to 48 hours, D 72 to 96 hours. Answer: C 36 to 48 hours. Explanation: the half-life of digoxin in patients with normal renal function is approximately 36 to 48 hours. This allows for once-daily dosing. In patients with impaired renal function, the half-life is prolonged, requiring dose adjustments to avoid toxicity. 2. What is the primary clinical effect of digoxin in patients with atrial fibrillation? A. Conversion to sinus rhythm. B. Decreased ventricular rate. C. Prevention of stroke. D. Increased blood pressure. Answer: B. Decreased ventricular rate. Explanation: in atrial fibrillation, digoxin works by increasing vagal tone, which slows conduction through the AV node, reducing the ventricular rate. It does not restore sinus rhythm but helps control heart rate in these patients, particularly in those with concurrent heart failure. 3. Which factor most significantly influences digoxin dose adjustments? A. Age. B. Body weight. C. Renal function. D. Hepatic function. Answer: C. Renal function. Explanation: digoxin is predominantly excreted unchanged by the kidneys, making renal function the most important factor in determining the appropriate dose. Impaired renal function can lead to accumulation and toxicity, so doses should be reduced in such patients. 4. Which visual disturbance is characteristic of digoxin toxicity? A. Blurred vision. B. Red-green color blindness. C. Yellow-green halos, xanthopsia. D. Loss of peripheral vision. Answer: C. Yellow-green halos, xanthopsia. Explanation: a classic symptom of digoxin toxicity is the perception of yellow-green halos around lights. This occurs due to digoxin's effects on the retina and optic nerve. Other visual disturbances like blurred vision can also occur in toxicity. 5. Which of the following electrolyte disturbances can both increase digoxin toxicity and reduce its efficacy? A. Hypercalcemia. B. A. Hypomagnesemia. C. Hyperkalemia. D. Hyponatremia. Answer: B. Hypomagnesemia. Explanation: hypomagnesemia can predispose to arrhythmias and increase the sensitivity of cardiac tissues to digoxin, enhancing its toxic effects. Magnesium plays a role in stabilizing cardiac cell membranes, and its deficiency amplifies digoxin's arrhythmogenic potential. 6. Digoxin is contraindicated in which of the following conditions? A. Left ventricular systolic dysfunction. B. Atrial flutter. C. Wolff-Parkinson-White (WPW) syndrome with atrial fibrillation. D. Chronic heart failure. Answer: C. Wolff-Parkinson-White (WPW) syndrome with atrial fibrillation. Explanation: in WPW syndrome with atrial fibrillation, digoxin can enhance conduction through the accessory pathway, potentially leading to life-threatening ventricular arrhythmias. It is contraindicated in such cases, and other antiarrhythmic therapies should be considered. 7. What is the primary action of digoxin on the autonomic nervous system? A. Increased sympathetic activity. B. Increased parasympathetic, vagal, activity. C. Decreased vagal tone. D. Inhibition of norepinephrine release. Answer: B. Increased parasympathetic, vagal, activity. Explanation: digoxin increases parasympathetic tone, particularly affecting the vagus nerve, which slows conduction through the AV node. This action is beneficial in controlling the ventricular rate in atrial fibrillation but can also cause bradycardia in cases of excessive vagal stimulation. 8. Which laboratory finding is commonly associated with severe digoxin toxicity? A. Hyperkalemia. B. A. Hypocalcemia. C. Hyponatremia. D. Hypokalemia. Answer: A. Hyperkalemia. Explanation: hyperkalemia is a hallmark of severe digoxin toxicity because digoxin inhibits the sodium-potassium ATPase pump, causing potassium to accumulate extracellularly. Elevated potassium levels can indicate acute toxicity and are associated with an increased risk of arrhythmias.